on Fox tonight. It has vexed women forever, and no matter how much people diet and exercise, some women say they just can't get rid of it.
We're talking about cellulite, those dimples of skin that you just can't seem to hide in a swimsuit or some outfits. But there is some new hope, and it's an FDA-approved procedure that gets rid of cellulite for up to 2 years. But a warning for you tonight, you're about to see a procedure that may not be suitable for everyone in your family.
We do Botox and fillers, where we do non-surgical procedures such as facials, laser hair removal.
You know you're in Scottsdale when you see reserved parking for Botox patients. You'll find this one at the MD Skin Lounge on North Pima Road.
More of a retail space that offers the highest quality of medical procedures, but in a med spa type of environment.
But this isn't any quick stop at the spa. The MD Skin Lounge is run by Dr. Brian Gawley, MD, a board-certified plastic surgeon.
Board-certified plastic surgeon, and in particular, I'm board-certified by the American Board of Plastic Surgery.
Besides his plastic surgery practice, Dr. Gawley, who also owns and operates MD Skin Lounge, is one of the first in the Valley to offer a cellulite removal procedure called Cellfina.
What it does in a low downtime in-office procedure is it smooths out the dimpling or that cellulite appearance.
It's genetic, and I take after my mom, and she probably wishes she was here today getting this procedure done.
On this day, Stephanie Schwartz was in the office for a Cellfina treatment.
I teach spin 7 days a week, and I've had the same issues for the last 20 years.
Clearly, this 35-year-old is in good shape, but when it comes to cellulite, it doesn't discriminate.
It's not related to being overweight or underweight. You have some of the leanest bodybuilding patients that can have cellulite, and certainly people that have a little bit of weight to lose can have cellulite.
As this animation shows, cellulite is caused by fibrous tissue beneath the skin that pulls at the skin, creating cellulite dimples. The Cellfina procedure releases the skin from these cellulite-causing bands, smoothing the skin.
Once the band releases, that pucker pops up and it's flat.
The procedure is quick, usually less than an hour, and there are no major incisions.
The incisions are the same size as if you were to go have have Botox, so basically it's like a needle poke. There isn't any cutting, there's no sutures involved.
Patients can go back to work the next day.
It's just local anesthesia, so I don't have to go under for this treatment, and I'll be back at it after lunch.
The little tool that releases those septae like we talked about, you'll feel that vibrating, but you won't have any pain or discomfort.
Great.
After an update from the doctor and a short prep period, Stephanie was ready for Cellfina.
Those two marks represent where we have two puckers, so we'll show you now how we're going to release those puckers.
First, the area to be treated is numbed.
This is the numbing medication. You can see it kind of fanning out.
Then, using a tool no thicker than a needle,
that's it.
Dr. Gawley detaches the skin from fibrous tissue, leaving behind some bruising that should vanish along with the cellulite in a few days.
Little poke. That's it.
No pain at all. Wow, that's amazing. If this works as well as I think it does, I'll just keep doing it as often as I need to.
To have that type of non-surgical procedure have such amazing results, both in the way they look and then how they feel about themselves, that's pretty exciting.
Now, a typical Cellfina procedure costs between $4,500 and $5,000. It's not cheap, but early studies show a 96% satisfaction rate among patients 1 or 2 years after the procedure.